The Delta variant of COVID-19 has caused a surge in reported cases and deaths in the past few weeks. Medical experts have pegged the Delta variant as the most contagious version of the virus, causing some states to reinstate their mask mandates. In the past week, COVID deaths have increased 26%, and according to the CDC, almost all COVID-related deaths have been among the unvaccinated. In the Black community, one of the primary deterrents of people getting vaccinated has been misinformation. Last week, during a press briefing, the White House acknowledged a group of 12 online vaccine protesters that they claim are responsible for 65% of anti-vaccine information posted on social media. The primary group impacted by this misinformation has been the Black community. Dr. Ashish Jha, the Dean of the School of Public Health at Brown University, had this to say about vaccine misinformation and the Black community on MSNBC.
There is concerted misinformation targeting the African American community, playing up historical and present-day racism and linking it to anti-vaccine rhetoric. It's really shameful. It's basically using one historical injustice to perpetrate another.
Joining us to discuss the COVID vaccine misinformation plaguing the Black community is Florida State lead for the Committee to Protect Healthcare, Dr. Bernard Ashby. Dr. Ashby, talk to us about where this misinformation is coming from that is targeted at the Black community.
Charles, pleasure to be here. And what up, though, to all of my people out there. So let me just kind of frame the conversation for you here. So you played that clip on MSNBC. This is a talking point that I've said multiple times. There is a ton of misinformation out there. I've called it the Misinformation Olympics. And what they're doing is playing into the inherent distrust that Black folks rationally have against our institutions, particularly the healthcare institution. A great example that I would like to bring up is a couple recently where the husband was held at gunpoint by the police after they declined care for their newborn. So they originally intended to deliver at home with a doula and a physician. Didn't quite pan out that way. It was an emergency delivery, and she had some complications, went to the hospital, and they did not want the baby's blood drawn and wanted the care to be continued at home based on their wishes. And if you know anything about Black women mortality rates in pregnancy, you will understand why they made that decision. But unfortunately, the healthcare system, I believe it was Los Angeles County USC system, they actually decided that they would do a check and incorporated the police as well. And it's stories like these that bring home the fact that a lot of folks in our community have a rational distrust of the healthcare system, and so they're not operating on a lot of the premise operating on the premise that's being framed in the media, where it's just solely on misinformation. There's a ton of folks who are rational thinkers and have decided not to get the vaccine for various reasons. And I think it's important for us to acknowledge the issues with our healthcare system that preceded the pandemic and will continue after the pandemic. And so to solely focus on misinformation, I think is kind of missing the boat.
Right, but I want to just say this though. Is it can't we frame it this way? There are three legs to this stool. Yes, there is a history of oppression and misinformation and maltreatment in this country towards Black people in all arenas, including the health care arena, right? That is a given. There is also, because of that, access hurdles to you getting sufficient health care that is good for you and in your community by people that you trust. That's the second leg. But the third one is, you could die from this, right? This is not like they're only giving this to Black people. This is only, most of the people probably in this country, not in the world, but in this country who've gotten this, the higher percentage of them have been white people. We have billions at this point people in the world who have gotten at least one shot from this vaccine. Just on the stats, if all the people, 99% I think is the number they're using now, of the people who are dying are unvaccinated, and only 1% of the people who are dying have gotten the shot, we have to say to black people, I get all the rest of it, but you have to get this because I want you to live.
So you're preaching to the choir here. I mean, I got vaccinated early on. My family's been vaccinated. My staff has been vaccinated. I even had vaccine clinics. So you're preaching to the choir. But again, you have to give people more credit than we're giving them, because the institutions, the media they're saying things that are actually not representing the truth. So, for example, there's this huge blind spot with natural immunity, meaning that anytime we talk about the herd immunity numbers, anytime we talk about vaccination and immunity in general, we ignore natural immunity like it doesn't exist. Well, there's been a paper published by in Israel, in Qatar. There's papers coming out from the Cleveland Clinic, from UCLA, all of which show that the natural immunity that you gain after an infection is on par with the vaccines. Yet we are misleading the public and telling them that natural immunity is not adequate, when in fact it is, because it actually is on par. Okay, and that is affecting a lot of our policies, and actually we're actually doing things that are not necessarily in the best interest of our country, because there's this huge blind spot. And people to us to communicate with them and be clear and keep it real, so that we can act vaccine when it's in their best interest. Furthermore, the institutions do not serve our people. The University of Pennsylvania just came out with a study that showed that the death rate for the Black Americans would be 10% lower where they if they had the privilege of going to a lot of these white hospitals. And so these are real issues within our community. And one of the things that we don't talk about enough is the fact that we don't have institutions that serve us, that serve our needs, and in fact marginalize us in many ways. And anyone who has trained in the healthcare system, has worked in the healthcare system, you see this every day. There's a fundamental lack of respect when they're talking to Black men and Black women. It's incredibly condescending. I deal with it now, as qualified as I am. When I'm advocating for my patients, the physicians will talk to me as though I'm a high school student, when I would run circles around them. But we need to acknowledge these real present issues and understand that a primary mediating factor is a distrust of the institutions. And until we address that, we're not going to address these other issues, because the vaccination rates have been low before the COVID-19 pandemic. I mean, flu vaccinations, general vaccinations have been low. Everything has been disparate when it comes to Black folks, Indigenous folks, and certain groups of Hispanics. So I think it's important that we have a real dynamic conversation and acknowledge that the system is failing us in fundamental ways, and we need to address that in addition.
Absolutely. Dr. Ashby, I really agree with what you just said. I respect that opinion. And also, I just want to make sure that our viewers know, we're not asking you to stop fighting the power, people. It's just that it is very hard to fight the power when you're laid up in the hospital on a respirator. I just want you to continue the fight for equality for Black people in this country. So thank you again, sir, for your time, and I really appreciate it.